call the meeting to order. Will the Secretary please call the roll?
Director Kim? I'm sorry, can you say it on the microphone? Good, thank you. Director Ryder is absent. Chair Harrington?
Present.
And for the record, those directors also attending, Board Chair Garza
Present.
and Director Staines.
And there is no one participating remotely.
I do not see anyone connected remotely. Yes.
Is there anyone registered for public testimony, by in-person or virtual oral testimony?
We did not receive any registrations nor any written testimony.
We'll keep going. So our next item of business is to have a report from Chief Corporate Compliance Officer and Privacy Officer Nicole Merrill. She will review the report. Come on up, Nicole. I'm sure you've done this before.
Morning.
Compliance and Privacy Officer.
Good morning.
Good morning. Thank you. All right, today we have metrics to share for both the first and second county quarters for fiscal year 2025. We have that for the system compliance program, as well as County Care Medicaid Health Plan compliance program, and we also have recoveries to share, and this is based on the state fiscal year, July 2024 through March of 2025. And then we also have a compliance education and training update to share. Thank you. Okay, so looking at the hospital and clinic side, we have metrics for December 1st, 24 through May 25. Our numbers are down from 505 last year to 399. We have 123 contacts that we haven't added due to staff turnover. So we have entered them, half of them now, and we expect the number to be much larger next reporting. Aside from that, the percentage of contacts are about similar from previous year. Okay, on the county care side, we have 376 contacts last year, and now we have 616. And this is largely due to the uptick in that first row there under fraud, waste, and abuse, which is the category driven by HFS OIG, and that's where we get our provider alerts, our requests for information, and et cetera. So that's 110 compared to 333 this year. So that accounts for the largest uptick on the county care side. Okay, now for recoveries on the county care side, we'll look on the left side there. We're looking at 9 months following the state fiscal year, which is July 1st, 24 through March of 25. In total, we've collected about $2.7 million in retrospective recoveries. Overpayments identified are decreasing from 10 million down to 2.2 million, and this is largely due to the wind down of our COVID lab investigations. And then on the right-hand side, on the preventative loss side, and this is where we're correcting mistakes before they happen, we've also seen a decrease, especially in Q2, from 8.3 million down to 3.1 million in Q3. Again, we believe this is largely due to the COVID lab investigations. Over a year ago, we established preventative stops to prevent bills from payments from being made. So we just think that is the largest reason for the numbers going down.
So I have a question.
Yep.
So that's what you think? Is there any data to support what you think, or are you going to keep digging?
That is largely what it's due to, is the COVID labs investigation. There's also a little bit was due to CVS. They have been, it's a little, that's our new vendor. They have a little bit of ramp up. So they're new as of last year. So we anticipate their numbers to go up, but this right here, what we're seeing is COVID lab investigation.
Thank you.
Thank you. Okay, for training and education, I'm excited to share at the last session, you asked for a summary of what we've done on the education and training front. And this year to date, we have done ACH compliance basics and privacy refresher training. We've done 10 sessions and trained 228 workforce members. And we did this, the program was informational about our compliance program, what kind of issues you would bring to compliance, who in particular you can go to right away for a specific question. And then we also did a privacy refresher training for those and reiterated the forms that they use for HIPAA authorizations, requests for information, that type of thing. We also did training for residents and fellows on the compliance program, so compliance basics, and we also did a deep dive into provider attestations because we revised the provider attestations a year ago, and this is part of a detailed education on what attestation to use depending on the workflow. And we have done 14 sessions and trained 146 residents. This is last year's residents. We also trained new residents at the orientation, resident orientation on July 1st, and there was 175 residents in attendance there too. Next, in the fall, during the annual compliance week, there's a national annual compliance week, we are going to provide a survey to those that we provide training to and ask how informative, how helpful that training was so that we can get data compared to last year's survey to see the differences, to see how effective our trainings were. Any questions on the training? I think the next slides give the detail about the trainings on who was attendance, what subspecialties and what locations we were at. Next one too, please. Yep. Are there any questions for me?
Any questions? Hearing none, a couple of observations. When is National Compliance Week?
The first week of November.
First week of November. Remind us.
I will.
And the other thing, you did talk about staff turnover.
Yeah.
That has had no impact on your ability to do the work.
No, we're doing the work. We had the county care compliance officer turnover since we last met, and we are actively recruiting for that role.
Any questions? Any other questions, comments, thoughts? Hearing none, thank you.
Thank you.
Our next item is the April 11th, 2025 committee meeting minutes. These were approved by the board at the May 30th meeting, but are being presented for the committee's review and discussion. If necessary, are there any corrections needed to be made? Hearing none, can I have a motion to accept the minutes of the April 11th, 2025 Audit and Compliance Committee meeting? Are there any questions on the motion? Somebody want to make the motion?
I'll make the second.
Who seconded? Okay. The motion has been properly moved and seconded. All those in favor, say aye.
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 Any opposed? The ayes have it. The motion carries. Now we're going to the meeting minutes of June 13th, 2025. Again, these were approved by the board at the June meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections needed to be made to the minutes?
And Chair Harrington, if I could just make a note on the motions, the committee members that are currently present are yourself and Director Kim. So
Okay.
it would be you and Director Kim who would be making the seconding.
Thank you, Deb.
Okay, so in the future, it'll just be the two of us voting, but if you, once you can raise your hand and indicate that you agree. How's that? Can I have a motion to accept the minutes of the June 13th, 2025 Audit and Compliance Committee meeting? All in favor say aye. Aye.
Aye.
Any opposed? The ayes have it. The motion carries. We'll now be going into closed session. Action is not anticipated to be taken in open session after the closed meeting has adjourned. We'll be discussing two items, a report from the Director of Internal Audit and some personnel matters. Can I have a motion to go into closed meeting? Go into closed meeting pursuant to the following exceptions to the Illinois Opens Meeting Act, 5 ILCS 112. 20/2, parentheses C, 1 and 29. It's been moved. Is there a second? I'll second it. It's been moved and properly seconded. All those in favor say aye. Aye.
Aye.
Any opposed? The motion carries. We'll now be going into, closed meeting.